Hi and welcome. In the presentation of today, we will be talking about IVDD, also called intervertebral disc disease, and this in our pets. This time, instead of doing what I usually do with my PowerPoint presentation, this time I'm bringing you a very special guest. But before we begin, please close up your phones, your TV, your tablets, Facebook, Instagram, and whatever, so that you have all your attention on this presentation. Because if you have a dog, chances are very high that one day he or she may suffer from this very common disease. And you will want to know all about it, to know what your options are, and to make the right decision for your pet. Intervertebral disc disease is the most common spinal disease in dogs and occasionally also in cats. The intervertebral disc degeneration results in diminished shock-absorbing capacity, and it can ultimately lead to disc herniation and spinal cord compression. Now, this is a theme that I personally have a lot of experience with because, as many of you know, I have a rescue center at my ranch for abused horses and dogs. And I have at this moment 3 13-year-old rescue dogs who have intervertebral disc disease. So some of these dogs have had protrusions, some of these dogs have had herniated discs, and one also had an exploded disc. That's the reason why he needed to be operated ASAP. 2 of these dogs have been paralyzed, 2 of these dogs have been operated, and one, as I said before, has been paralyzed 3 times. But today, instead of doing this presentation on my own, like I always do with my PowerPoint presentations, today I thought of doing it in an interview style of way. And so I'm introducing you to Dr. Terry Wood, a holistic vet from Mustang, Oklahoma, and who I have known through Dr. Brian McLaren of Photonic Therapy for about 10 years now. Dr. Terry Wood has worked with Dr. Brian McLaren personally and has been using photonic therapy for over 15 or maybe already almost 20 years. And as you may know from the interview I did last month with Dr. Terry Wood on my page of photonic therapy on Facebook, he has made over 200 dogs with paralytic symptoms from IVDD walk again without operating them, but by using photonic therapy. So in the presentation of today, I will let him answer the 3 learning points. These learning points are the following. What is intervertebral disc disease? What options do I have for my pet with IVDD? And how can photonic therapy, the McLaren method, help my pet? And if you stay till the end, I'll give you a link to a specific bonus which I have prepared for you for this presentation. Now, let me introduce you to Dr. Terry Wood. So, Dr. Terry Wood, welcome to this presentation. I know that you are a holistic vet and that you have a veterinary clinic in Mustang, Oklahoma. Could you, just to introduce yourself so we know, so that the people who will watch this presentation know who you are, could you just give us a little bit how you got there to be today a holistic vet with practice in Mustang, Oklahoma?
Sure. Well, I grew up in a farm in northeastern South Dakota. We raised cattle and small grains. And then I always wanted to be a veterinarian. I went to first went to college at South Dakota State University and then vet school at Iowa State University. I graduated in 1981. And then I worked in a small animal practice in western suburb of Chicago for about 6 months. Then I worked as a large animal vet in southern Oklahoma for about 4 years. And then I ended up in Mustang, Oklahoma, western suburb of Oklahoma City. And my journey actually started, it was my first year out. And it was one of those epiphany type moments. I'd been called out to examine a lame horse. And the rancher said, well, what's going on? And I was really proud of myself. I did a really good lameness exam and did nerve blocks and told him what it was. I forget what it was now. It's been almost 40 years ago. But I do remember he said, what are you going to do? And I said, well, we're going to put him on Butte, an NSAID for, a couple weeks. You rest him for 6 weeks. He should be just fine. And, you know, the old rancher kind of looked at me and he said, well, I thought you were going to fix him, not just cover the symptoms. He said, how many things you cured by just masking symptoms? Not what I was expecting to hear, but it was like, well, sir, I graduated just recently from vet school, and that's what I was taught to do. But that kind of stuck with me. And so now I'm kind of a slow learner, I guess, over about 15 years, I finally realized, and from talking with other veterinarians, holistic veterinarians, that's about how long it takes, where you realize I've got to look for something else. And so that's how I ended up, you know, becoming a holistic veterinarian. It was a slow process, but certainly hearing Dr. McLaren speak for the first time was real pivotal in that.
Yeah. And how long have you now been a holistic vet?
Oh my goodness, probably about, probably about 23, 24 years, something like that.
Now, today we are going to be talking about IVDD, which is called intravertebral disease. Can you tell us a bit more about what this is?
Sure. Yeah, it's a problem that we see very, very commonly, very frequently. And what the discs are is they're basically little pads that are between the body of the vertebrae, and their job is to act as shock absorbers and allow the pet to move without pain and all that. Well, what happens, you know, anatomically, they're made up of two layers. It's kind of like a jelly roll. They have an inner layer called the nucleus pulposus, and then an outer fibrous layer called an annulus fibrosus. And problems happen when these start bulging. You know, there's about, you know, they call, you know, we'll see them come in. You know, there's different grades of the disease, but when these discs start bulging or exploding, you know, it can be anywhere from just being uncomfortable in the back, or it can be complete paralysis. And as far as nomenclature, you know, there's different ways to do it, but I've heard the Hansen 1, Hansen type 2, and Hansen type 3. The Hansen type 1 is what we see a lot in pets, and it's where it's a bulging of the inner part of the disc that pushes up. And then the Hansen type, and it's more an acute episode. The pet's fine, and then all of a sudden they're not. And, you know, probably half of those are associated with some type of trauma, but half aren't. Sometimes it just happens. They turn wrong and there it goes. The Hansen type 2 is more of a chronic situation. It's what people get. It's where it's a kind of a bulge in the outer fibers in the annulus, and it's just a chronic, you know, pushing and you know, over a long period of time. And then of course the type 3, I think I saw in your notes you had one where it's just a sudden explosion. So it's a high pressure, low volume type of a deal. But you know, that's what we see happen. And of course there's the two areas that they happen. It's either in the neck or at the thoracolumbar junction, the upper lower back. And anatomically there is a bit of a difference, because in the lower back, the spinal cord is a perfect fit in the bony canal, and there's no ligament that protects it on the bottom side. So that disc is sitting just underneath it. When it pushes up, what happens is it pushes right on the spinal cord, and that's not good. And then, of course, in the neck, there is a protective ligament that runs down the bottom side of that bony canal. And that tends to, when a disc is pushing up on that, it tends to get shunted off to the side where the nerve roots come out between the bodies of the vertebrae, which, you know, and also there's a little room for the cord to swell. So if you had to pick one, sometimes the neck is better, but with either problem, you can end up from just minor pain to a complete paralysis. But, you know, that's what we see. And that's the saddest thing in the world, is to see a pet coming in, dragging themselves, or just really in quite a lot of pain.
Yeah. Now, my question to you is, when something like this happens, because it happened to me too, my vets only gave us two solutions. He says, you need to operate, and you need to operate now before the dog is going to be paralyzed. And if you're not going to operate, that dog is in so much pain, or will get into so much pain, it's better to put him to sleep. Now, on the other hand, my vet is one that will never put to sleep if he doesn't have to. But that is what most of us are being told. Okay, you have two options. Either you operate or you put them to sleep. Now, I know because we have talked before, you were interviewed by me on my Facebook page, on Photonic Therapy page, and I know that what you have done for these dogs is totally something different. So I want you to explain to everybody who will be looking at this presentation, what would you do when you have this situation, and what have you done in, I think it's been over 15 years that you have been using photonic therapy. So tell us about that.
Yeah, actually, it's about 20. I was counting it up. You know, one year's just like another. So I asked one of my employees, I said, when did I start this? And she goes, it was 20 years ago. I was like, okay, seems like yesterday, but that's okay. Yeah, when the pet comes in, and I'll have the discussion with the owner, you know, depending on the severity, it's like, okay, here's what's going on. And to make it understandable, I'll say, look, it's like they popped a disc, they slipped a disc. It's putting pressure either on the cord or the nerve roots if it's in the neck. And I said, here, you know, and your pet's in trouble and it's in a lot of discomfort. And so here are options. And I always give the option for a traditional approach. I said, if you would like, I'll be happy to refer you to the big place, the board certified surgeons. They have an MRI, a CT machine, and they can do all that, and they can do surgery. And you know, the classic surgeon, you know, chance cuts, chance cure. And I will give them that option, and some people choose it, and that's fine because they're not comfortable with the approach I take. And then they go, well, a lot of them say, well, wow, that's a lot of money. I don't think I can do that. And will that be a guarantee my pet will be normal? I said, well, no, you know, none of us has a guarantee we're going to wake up. The only guarantee is you're going to have a big bill. But if that's the way you want to go, I will refer you there. I'm not going to tell you this is the only way. But well, of course, my preference is to treat them with the light. And what I'll do is really, I think the big thing that I feel so good about it is that by using the principles that I learned, we can treat the entire pet, because some veterinarians are really living on the edge, and they'll use like the low level laser, you know, to treat the sore spot, to treat the area. Well, that's fine. That's going to help. It's not a bad thing, but you're very limited because you're just treating that sore spot. And that's one of the big things, is that, you know, holistic, you have to treat the whole pet. And one of the big things is that when you have that disc putting pressure on the spinal cord or the nerve roots, you have a compromise of the blood flow. And that's the reason that they'll say, well, we have to do surgery right away to relieve that pressure, you know, because ideally they'd like to do it within 45 minutes of the bulge occurring. And then, of course, if it doesn't work, it's like, well, you didn't bring him in time, so it's your fault, not my fault. I did what I could do. Yeah. But that's what the photonic therapy allows me to do, is to treat the entire pet, control the bleeding, and you know, just fix more than just putting it on the sore spot. And of course, I will treat the sore spot, but I'll treat the entire pet. And you know, we have a lot of people are pretty. You know, initially it's like, you know, my dog can't walk and you're going to put that red light on. And it's like, yep, sure am. And then when they get better, the people are like, wow, that really worked.
Yeah. So the other day you told me that in your career, you have made over 200 pets walk again without using the regular painkillers, without using the operation. Could you just explain to us that how can photonic therapy in the McLaren method that we are doing, how can this therapy help the pets? What do you do? How does it work?
Well, what I'm really, you know, and I'm like the second grader. Ask him a question, he tells you a story. I had one, it was a veterinarian friend of mine that had a pet that it was and I think a little 10-pound, 8-pound poodle. And she was having a lot of back pain. And of course, he was treating her with NSAIDs. And I've used NSAIDs on one hospice care pet. That's it. Because the reason that I don't like NSAIDs, the non-steroidal anti-inflammatories, is because they actually will make the blood not clot. And they will they actually delay healing, and they can cause, very severe damage with the liver and the kidney, and even punch a hole in the intestines where they end up with a bleeding ulcer and they can die. So needless to say, I'm not real fond of NSAIDs. And so that's what he had this little pet on, was all these NSAIDs, and pet was in a lot of pain. The owner was pretty, upset about it. And he said, well, do you think that light do you think that would help? And I said, well, sure, let me give it a try. And so I went ahead and treated the pet. I think after the third time, the pet was completely out of pain. And, the owner was able to discontinue the medication. And she said, well, what do we need to do? And I go, we're done. We're good. And she said, okay, I'll see you Friday. So she liked how it made the pet feel. But again, I think that's the big thing, is where the photonic therapy allows us to treat way more than just the sore spot. And if there's other problems going on, we can help treat those, which the ultimate goal is to get the pet healthy, out of pain, and get them walking if at all possible.
Yeah. So now we all know that photonic therapy has to be used post-diagnostically. And that's also what I say always on my page, to say, whenever something's wrong with your pet, you go to the vet. Now, in what way are you different than other vets? Let's say this way. When imagine that we have people here watching this presentation who are having a pet who is on high medication, or whose vet has said that the pet needs an operation. How do you do that with people who don't live in Mustang, but live a bit further away and would like to come to you, would like to have your opinion, and would like to see you give a photonic therapy session to their pets to see, to heal it, to relieve that pain? How does it work? How can we contact you? Tell us about that.
Yeah, they can contact me through my email, which is terry@terrywooddvm.com. And I actually had a lady from Houston, which is a good bit away from us, and she drove up and spent 1 or 2 days, and I treated the pet. She had actually, I believe, she purchased a torch, and I showed her how to do it. And so I treated the pet, I think, twice, and spent a couple of times working with her, showing her how to continue the treatment at home. And she drove back to Houston, and I, kept in contact with email, and the pet did fine. And she was really happy that she could do that. So sure, you do have to come see me, but center of the universe, you can come to Mustang, it'll be okay. And we can get you taken care of. And of course, with you offer classes, and that's who they need to buy their torch from, is through you. And that's fine. Cause if at all possible, they could buy their torch first and have it in hand and come up. But yeah, we could spend, an hour or so, treating the pet, going over everything, and to where they were comfortable doing what they needed to do.
Yeah, so this would be ideal for anybody who lives further away. They just come and stay 2 days in a hotel nearby. So you can, I'm just giving an example. On Monday, you give the dog a session, so they see how it's done. And then on Wednesday morning, they come back for another session. And by then, you will have shown them also what points they have to do, how long they have to do it. And then they can go home and continue the treatment. In other words, you would be the first one to help the animal, but giving them the possibility to continue to do this at home themselves later on. So in other words, yeah, it's like you say, Mustang is maybe not the center of the universe, but what is the fact is that it's not because you're living further away that you can't give to the animal what it needs, because you don't have to be there all the time. If you can do it, if you can show it, those people can then continue doing this at home. Yeah, it sounds great.
Well, and I think one of the big points that I think is the crux of the whole matter is that how I was taught, which is traditional Western medicine, is that, and that's why there's such this strong belief that we have to do the surgery, because we've got to make it look right. Because in Western thought, function follows form. In other words, if we correct the form, if we correct this bulging disc, or if we make it to where it looks right on X-ray or MRI or CT, that means it's going to work.
Yeah.
Well, unfortunately, that's not always the case.
No.
And the Eastern thought is that form follows function. In other words, let's just make it work, and then it can
We'll
look
see
like
what happens.
however it wants to. I don't care what
Yeah.
it looks like, as long as the pet's up and walking,
Yeah.
it's just fine. And I'd seen that early in my career. We had a pet come in. We did a few small animals when I was in Southern Oklahoma, and the pet was running everywhere. We took an X-ray of its hips because we thought it had been kicked by a horse or something, and he had no hip joints. They were completely gone, and yet this pet ran everywhere he went. And I'm looking at that going, how can that be? There's no, you don't have the good ball and socket joint. They were this far apart, and yet he ran everywhere. And it's a hard concept to come across, but it gives hope where the owner says, well, they're facing a $5,000 or $6,000 surgery and scan, and I've had those. I've had pets come in that had the $5,000 surgery and scan, and they were good for 10 days, and then they went down again. And then the owner said, wow, and they went back to the place and they said, well, you owe us another $5,000 and we'll do it again. Yeah. And they said, no, we're not going to do that. But again, the traditional vets, they're going to put them on an NSAID, and that just really bothers me, because you've got a pet where you've got this injury and you've got some bleeding in the microvasculature, and you put them on an NSAID, and that bleeding isn't going to stop. Yeah. And that, and it's going to inhibit healing and delay all that. Yes, it'll help with the pain, but they're going to be painful and paralyzed now. So it's really frustrating, and to think that, but that's how you're taught. And it takes a lot to, make the change and go, hey, there's got to be a better way to do this. But after you've seen a bunch of those, you kind of realize, well, are you doing this for the pets, or are you continuing to do that because it's quote unquote the standard of care, or are you more interested in trying to help the pet, maybe stepping out and trying some new things? And that's what when I've talked with other vets that have made the turn to holistic medicine, it takes about 15 years for you kind of become deprogrammed from what you were taught, because these are very brilliant people, and wow, these people are good, and I need to believe what they say. And then after a while, it's like, well, not everything they say.
That's true. And in my situation with the tree that I have here, two of the three have been operated. Okay. With Tommy, with the exploded disc, we had no choice. The vet had to get in. That was one thing. I had another pet, Gypsy, who has had problems cervical since 2015. And then in 2017, it started in her back. Well, we're at the end of 2019. They are 13 years old, but no, she never had the operation. I'm still using the photonic therapy on her whenever she needs it. And the difference is the two others have been operated by the best neurologists that I know. So they really got the best care that they could have. And both came out of the operation paralyzed.
Yeah.
So in Tommy's case, he recuperated quite quickly, but Cheyenne had in the wound a bacteria, so it got infected. Then she got meningitis. It was one thing leading to the other. And then the vet said, Eva, it's now for sure she will never walk again. And I said, you know what? We'll have a look how much photonic therapy can still do. It took a little bit more than 2 months to really be able to walk good. But yeah, she is now the best of all of them. And she's walking again. She's even running again. I quickly made a little video yesterday so that I can put it in this presentation just to show people. And with Tommy, well, he was operated on 4 discs with that exploded disc. And he was paralyzed. I got him back to walk again. Lots of exercises also to make him walk nicely. And this year, it started again on some other discs, and the vet said, I can't operate anymore. So I said, no problem. I'm just going to use my red light. I brought Tommy back to walking again in July, but now he's down again, and they are just old. I am making him comfortable, so he's not in pain. I can still moving around. I have a walker for him. We move around here, and we're having fun. But at least I am able to help these animals. And for me, the most important part of this is I can take that pain away. I can relieve that pain. Even in one case that I've brought Tommy back twice after being paralyzed. I brought him back twice. So I made him walk 3 times. And I'm not even a vet. But I can do that thanks to photonic therapy.
Right. And we, and of course, when we are dealing with the pet, when they are paralyzed, one of the most important things is we'll teach people how to manually evacuate their bladder, because that's one of the chronic problems we see is chronic bladder infections. Because if they're totally down, they can't empty their bladder properly. And that's a real important thing, because that happens every time if you don't address that. And we're fortunate because there's a facility. Some veterinarians, after they do the surgery, they might have one of those water treadmills where they can put the pet on. Mm-hmm. But there's even a place here in Oklahoma City that I've used several times, recommended, and they actually swim the pets. And that's, I think, way better than even the treadmill, because they get in this saltwater pool with the pets and they encourage them to start moving, and the pets, that's really a big part of their therapy. So, but yes, when you start combining all those things together, you've got a really good shot of getting them back. And, it's like everything else. It's not going to be 100%. There are going to be some pets that do not respond, but at the very least, you can get the pet out of pain, and then we can deal with the owner's comfort level. It's like, are you comfortable with the pet getting around in a cart? Which means you're going to have to empty his bladder several times a day manually and have some challenges. But, at least there's options other than saying, well, spend more money on a surgery or put him down. That's it. We can offer options. But again, I'm quick to tell people, it's like, I can't guarantee the sun's going to come up tomorrow morning, but we'll certainly do our best to try to do all we can to help them. And I feel very comfortable with offering that.
Yeah. Well, Dr. Terry, it was a pleasure to have you here with me today. And last advice, last tip that you would give any dog owner, even if they live far away from Mustang, but there is always a chance to get to you, what would you advise them to do?
Sure. All they'd have to do is just send me an email and contact me. And we do have an airline in Oklahoma City, or where 3 major interstates come together. So it's easy to get here. And even if it wouldn't be possible to bring the pet in, they could certainly come, and we could do a one-on-one. My dog can volunteer to be the model, and we could, we can show people what to do. So, even if you can't bring your pet with you, say it was a big pet that was down, that's fine. You can still come, and we can still spend, some time and help you to figure out how you can help your pet.
Yeah. And if these people already went to their own vet and have x-rays or MRIs, can they also contact you to have your advice when they would send that over to see if you can still help that pet? If an operation can be avoided.
Yeah, it's kind of funny you say that, because the one where my veterinarian friend, the lady in between leaving him to come see me, she spent, I think it was like $2,700 or maybe $3,000 to have an MRI or whatever she had done. And she said, "Do you want to see that?" And I said, "No." And she said, "Why not?" And I said, "Really doesn't matter what it looks like. How about if we just get your pet well?" So I never did look at it, yeah. So it was kind of funny. So, if they've had it, it's fine. But again, it goes back to the point that, because I had read a study years ago. It disappeared. I couldn't find it again. And then I actually heard a spine surgeon advertising here in Oklahoma City about, he said that people will come to him. And this is a minimally invasive spine surgeon that doesn't claim to be holistic, but he's slipping to the dark side. I can tell because he said people will come to him and go, "My back hurts. Do you want to see my MRI?" And he goes, "No. Well, if you take, I forget the exact percentage. I think it was like if you're over 45 or 50, 60% or 70% of the adults, it was a large number, have lesions in their spine. You're going to see bulged disc. You're going to see calcified disc. You're going to see a lot of those problems. And it doesn't really matter because a lot of those aren't causing any problem. And I was shocked to hear that because he's not claiming to be a holistic, minimally invasive spine surgeon, but you are, because he said it doesn't matter what it looks like. So, I mean, that's fine. You know, of course, if they've been run over by a truck and their spine is like this, okay, it needs to be like this. That needs surgery. But if the people looked at the scan and said, well, you've got this lesion here and you've got this lesion here, that really doesn't mean that much. And I'd read a meta-analysis where they study things, and it was a physician that they looked at people that had back pain, and they looked at what was done to them and what the outcome was, and they were thinking that the results would be that the higher level of diagnostic imaging that was done, you would see more lesions, and therefore you would get them fixed and you would be well. And what they found is that the patients that went in and they maybe had an x-ray, maybe didn't, they said, well, you've got a sore back. They were put on muscle relaxers and some kind of pain relief, actually did better than the patients that had the higher levels, you know, up to the, you know, they don't do a lot of things they used to, but now with the CT and MRIs. But the people that had all these advanced diagnostic testing things done, they found more lesions, and they had surgery, and it ended up, they did much worse than the people that just said, hey, I got a sore back, do the, you know, the packs and the muscle relaxers and you'll do fine, which was kind of shocking, because you know, your Western mind says, well, I was trained to find that lesion, and if I fix the lesion, I'm going to make it work. But I was, you know, shocked, you know, in my own experience. I said, no, I don't really want to see it. It doesn't matter. And I heard this spine surgeon saying that. I was like, wow, okay, I like that, because that's what it boils down to. But, you know, it gives us something concrete to hold on to. I mean, we can't hold on to the red light and this is what we're going to do. It's like, you know, and, you know, you can't take an image before and after and go, oh, well, look. But what we can do is we've got a pet that's now hopefully out of pain and walking, and that's the proof. So, yeah, sorry to ramble, but that's kind of a big deal, I think.
To me, you seem to be the cheapest vet possible, because you don't want the x-rays, you don't want the MRIs. In other words, when people come to you, they won't need to do all that. That's almost too good to be true. Yeah, it is. People like, that's it. And I go, that's it. You know, and one thing I do, because I do a lot of work with minerals, and one thing I found too is that, and I don't know if this would have any relation to it, but the mineral levels in pets and people are sadly lacking. And one of the things, I will use a bioavailable copper supplement, because copper is an important mineral. There's two copper-dependent enzymes that help convert proelastin to elastin, and that's what keeps blood vessels stretchy and strong. And a lot of these pets, I think, are more prone to them because many people are chronically mineral deficient, and without that on board, you know, their vessels are much more fragile and they'll bleed easier. So when you have that bulge, you know, you have proportionally more damage. So I will do that. In addition, I'll provide them with some copper supplement, because I really think, I mean, it's just like the idea, if I give an antibiotic, because you have to give antibiotics for infections, I give a probiotic, because I tell people we're going to kill good bacteria too, and this will help that. So, you know, that's one of the other things in adjunctive therapy that I always, you know, incorporate, because, look, we need to make those blood vessels strong. And because, you know, my assumption is, I think I'm correct, most of them aren't real strong, and we need to help them. Yeah. Okay. Well, that was great information. I am also already thanking you for your presence today.
Okay. Thank you for having me. I sure appreciate it.
The pleasure was all mine, Dr. Terry. If you want to get in contact with the holistic vet, Dr. Terry Wood, you can find him at www.terrywooddvm.com. That's his website. His email is terry@terrywooddvm.com. His veterinary hospital is located in Mustang, Oklahoma. And the phone number of the clinic is 405-376-1320. Make sure when you contact him to let him know that you find him through this presentation.